Hi, sorry, don't mind the gross cat back there in my unmade bed. I am going to do a line progression for you. I wish that I could say that this is gonna be a happy, like, yay, I'm pregnant video, but unfortunately it has been bittersweet. I'm probably going to cry. I am 2 days post-operation. I went to go see my OBGYN when I was only 3 weeks and 5 days, 6 days, I'm not sure. I don't math well. But not even 4 weeks. I hadn't even missed my period yet, but I had gotten a positive pregnancy test really early, and I've had 5 miscarriages, so I wanted to have my HCG checked and my progesterone to make sure that they looked good and could support the pregnancy, and if my progesterone needed to be supplemented or anything like that, I could do it early. But unfortunately that isn't how my visit went. I just moved to a new city, so I had to get a new OB-GYN, and this was the first time for me to see her. So the day of my appointment, I got a phone call from the nurse telling me that the doctor wanted me to get an ultrasound before I went in, which I didn't want to do because having had so many miscarriages, I knew, like, with it being so early, I probably wouldn't see anything, and it just would have broken my heart. But I told the nurse, like, I don't want to do that, and do I have to? And the nurse pushed and insisted and said that, like, if I want to see the doctor, then I have to get this ultrasound. So I told her, like, it sounds like I don't have a choice, so I guess I'll go get the ultrasound. So I went to the place where I got the ultrasound, and of course she didn't see anything in my uterus. My uterine lining did look like thick. I mean, it looked, I'm an untrained eye, of course, but it looked like other early sonograms that I've seen for people who have just gotten positive pregnancy tests, but it's too early to see a gestational sac. So I just told myself, like, that's probably okay, and the technician reassured me that it was probably just too early, and she kept, scanning all of the other organs and such in there, but she didn't give anything away. So when I went to see the doctor right afterwards, I didn't expect anything other than, like, we don't see anything. But that's not what happened. I got there, and her nurse did just a very, very brief medical history on me. They didn't even have me do any intake forms. It was pretty bizarre. So took me back, weighed me, asked me the typical questions, like, when was your last menstrual period? I had recently had a miscarriage, so I didn't have one, but I knew, I inseminated on the 30th, which was my birthday, and the 3rd, which was my best friend's birthday. So I knew, like, either way, this baby would have been conceived on one of our birthdays. And every time I tried to tell, like, one of the staff, nobody would listen to me. And so they were dating me from when I had some spotting, which was the 15th. But I don't think that dating was accurate, and I tried to tell them, and I didn't really feel listened to. So they kept saying, well, you're like 5 or 6 weeks, we don't see anything, and at this point, like, nobody has even had me, like, pee on a stick or take my blood to confirm that I'm even pregnant. Like, I could have just been making it up. Not that I would do that, but like they didn't even know. Anyway, so the nurse steps out, tells me the doctor will be in. As soon as the doctor comes in, she doesn't examine me, she doesn't ask me any questions. She has the ultrasound pictures, and the first thing I say is like, oh, I know it's gonna be bad news, like there wasn't anything there, but I think it's still early, so like that's okay, right? And she says it's not what I didn't see that worries me, it's what I did see. And so at this point I'm like just shaking, because I have no idea like what she's going to tell me. So she shows me the ultrasound pictures and she says like, this black spot here is fluid, which I think is blood, and this here looks like it could potentially be an ectopic pregnancy. And like, honestly, I was really confused because I didn't think it would show up that early, and then especially not with what she said afterward, because she then goes like, the fluid indicates that it's probably between like 5 and 6 weeks, and it looks like your tube is about to rupture because there's fluid in your abdominal cavity. And like, I knew it couldn't be 5 to 6 weeks. Like, I'm gay. Like, I know when semen entered my body, and it wasn't that long. So I mean, like, just trying to rationalize like what she's telling me, I was like, well, maybe like I just thought I miscarried before, and this is like that last pregnancy, and I'm only just now having positive pregnancy tests. Like, I was really confused, but I was trying to make sense of this. I was trying to like rationalize and make this make sense. And so then she tells me that the options would have been to do methotrexate, I think that's what it's called, to essentially abort the fetus or the embryo, or to do to admit me to a hospital and to do like repeat test, kind of like the wait and see. And again, at this point, like, she hadn't even taken initial HCG reading on me, so she didn't know what it was. But she told me those things weren't really options because of the fluid in my stomach being a really strong indicator that my tube was about to burst, and that if I didn't go to the hospital and have that surgery Wednesday, that day that I saw her, that it was very likely I would either lose my tube and or die. And of course, when you hear like you're gonna die, that sort of takes all of the other options off of the table. So like, I was sobbing, I was just like, couldn't think straight. I was alone because of COVID, and she's pushing the surgery at me. So she comes in, she leaves and comes back with the forms for consent to the surgery. And mind you, still, I have not even been asked for a urine sample to confirm pregnancy. I consented, I signed the forms, but I don't feel like I was really truly informed. I don't feel like she really clearly, adequately explained my options to me, because at the follow-up today, she told me that that surgery wasn't the only option, that I had a choice. And I felt like if she hadn't told me I would have died without that surgery, I never would have consented to it. I had never had surgery before. I'm a sexual assault survivor, and like, being that vulnerable and exposed and having to trust strangers with my body is traumatic and terrifying to me, and it was just an awful experience. But that's what happened. So I signed the consent forms, and she stepped out of the room to arrange the surgery with the hospital. And backing up, this is important. When she was telling me about all of the options, I told her I was confused because I felt fine, like I felt healthy, like I didn't have any bleeding, I didn't have any abdominal pain, I just felt a little bloated, a little gassy. But I assumed like if your progesterone gets higher, that's kind of normal. So I was just really confused why this was so urgent. And she was like, "You're sure you don't have any symptoms? Like, you feel fine? Like, you're fine?" And then she asked if she could touch my stomach, so I let her, and she asked me, like, "Does that hurt?" And I'm like, "No, it doesn't hurt at all. Like, I barely felt anything." So she knew I had no symptoms. Like, I was stable, other than what she thought she saw on this ultrasound. But so while she's out there talking to the hospital, the nurse asks me to finally give a urine sample to test for pregnancy. And while I am coming back from the bathroom to go back to the exam room, I hear the doctor lying to the hospital about my symptoms to get me in for this emergent surgery. And she told them that I had severe abdominal pain, that I had vaginal bleeding, and that like it was an emergency, that I got in there today. And so by lying, she got me in. I really wish that she hadn't. I wish that I had had time to sit with that and think about it, because it was probably one of the worst days of my life, and I've had some bad ones. So she tells me to go to the hospital and check in at surgery. So I do what she says. I go to the hospital, I check in. And finally in pre-op, somebody comes and does blood work on me, and they get my HCG level, and it comes back at 146, which I think is good. Like, from everything I've read, I think is good for not even 4 weeks. I hadn't even missed my period yet. But again, like, nobody was listening to me when I said that I was not even 4 weeks yet. So when the doctor comes in, she's like, "This is what your HCG is," and you know, that's not good for how far along you are. Like, that to me also suggests ectopic. So it's a good thing, like, we're doing this surgery. And at this point, I had a horrible migraine from all of the like crying and the nervousness and the fear, and like my blood pressure had shot up to 147/100, and my pulse was 139. It was a mess. So I was along for the ride. Like, I didn't feel like I had any say, any choice. I didn't feel like I had any voice. But I did try and tell her one more time, like, "I don't think you're right. Like, I don't think I'm that far along." And she just was convinced that I was wrong. So I was wheeled back, got surgery. She looked at my tubes. There was nothing wrong with them. She didn't see anything there. And the fluid wasn't blood. It looked like a cyst had just ruptured. So she cleared the fluid out, closed me up, and sent me back home with prescription ibuprofen for my pain, and told me to follow up today, 2 days later, which I did. And again, she didn't test my progesterone at all. I've asked for that probably like 6 times now, and nobody's done it. So I'm pretty sure, like, in her mind, there's not a viable pregnancy in there, so why should I even take any steps to take care of it? So at this point, I don't have any hope. I'm pretty sure if I have a baby, it's dead, or just never grew in the first place, because she's convinced that it's not viable. So yeah, but all of that said, all of that aside, I think that my experience and my story is hopefully uncommon. I really hope that nobody has to go through this, because it's awful. But yeah, I mean, it's so terrifying to go in with so much hope and excitement, because like I'm about to show you, my tests were getting darker and they were just beautiful, and I got this early positive, which has never happened to me before. I always have really low baseline HCG, and it takes a while. So I thought this time was going to be different. It was going to be my healthy baby. And then she tells me it's ectopic and I have to have the surgery, and if I don't, then I'm dying. The whole world crashed down around me. And ever since the surgery, my tests have been some a little bit lighter, some just the same. And the one I took just now, I can't really tell because I'm crying and I can't see it, but it might have gotten a little bit darker, so that gives me a little bit of hope. But I'm just crossing my fingers that she's wrong and that my gut was right and that this baby is okay. But I don't know. Anyways, all of that to say, in the beginning, my test progression was really beautiful, so I really still want to show that to you guys. And I'll make an update video once I know the outcome of this pregnancy, so maybe it'll help other people to know like what a length progression can look like if it is an ectopic and if it's not. So anyways, here we go. I am tested at 8 days past ovulation and had just a really faint line. Like, I couldn't even tell before I took it out that it was positive at the time. So then I ordered some more, and then the next day I took this one. Sorry, it's gross. My urine was dyed from the B vitamins. And I'm like mouth breathing because surgery, but and crying. But you can see it got dark enough to where you could tell like definite positives. So then later I wanted a digital. This used to say yes, but it's been too long now and it has gone away. But so also 9 days. So this was 9 in the morning, and then this is 9 days in the evening. And then I wanted to try with the clear blue because they got these pink dye ones and I've never used those. So at 10 days past ovulation, I got this clear blue. Again, gross because of vitamins, but pretty clear. Like, I think, I know it's apples and oranges because 2 different brands of tests, but I thought that was like pretty good for like, I don't know, a day. But of course, like, I don't know what it would have looked like on a first response. But because that was clear enough, I was confident that I would get pregnant on the digital. So I took that at 10 days past. Also, actually, it looks like I did the first response and then I did this one. Anyway, and then, because I'm a pianistic addict, I was really happy with this one. So, not those. I'll get back to this. I need to take a breath. I'm so sorry. Okay. So this one was 10 days past at 2 p.m. and it's pretty light. But then the next day, it got super dark. That was at 8 in the morning. So that was the first morning urine. So of course that's going to be stronger. But I mean, also like that's not even 24 hours difference, and like, look at that. So I was so happy, like I was so excited, like this thing looked like it was doing exactly what it was supposed to. And then at 11, I got this first response, which if you compare it to the 9, let me pull these out, looked really good to me too. So I was really happy with that, because that's again another 48 hours. And I could definitely see that my HCG was going up really well. And now in hindsight, I'm like, why was I even worried? Why did I go to the doctor? Like, I'm questioning everything. And then in another 2 days, the day after surgery, I got this first response, and I mean, maybe there is a difference, but I don't see one. So that scares me. I haven't really seen much of a difference at all in my tests since having surgery. It looks to me like my HCG has stopped going up. I expected by today, by my missed period, well, today is the day after my missed period, but it's 14 DPO. I expected for it to give me a line as dark as the test line, and I haven't really seen that. So that, I don't know, hurts my heart a little bit. So there's these, the more expensive test. And I also did the cheapy test. That's actually how I found out in the first place. So I'm gonna put those aside and show you the cheapy ones. I put a note in there. I was emotional and a mess, so just disregard the note. So on this side I have my tin MIUs. They're the early result ones for OneFlow. And then on this side I had just a few left of the 25 MIUs, so I used those as well. So I started it really early at 7 days past, and like, I don't even know if you can see it. There was a shadow there, but I think that's just kind of because these are so sensitive. I don't think that's a true positive. But in the evening, it did get a little bit darker. So like, in hindsight, that does worry me a little bit, because if I did get a positive at 5 days or at 7 days past ovulation, then that would have meant maybe implanting at 5, which I feel like could support an ectopic pregnancy. But I could also have my actual ovulation date off, and I could have implanted at 6. Like, that kind of variation I think is possible, but not like a week or two like the doctor is trying to tell me. But anyway, then at 8 days past, you can like clearly see it. And then 9 days past in the morning, 9 days in the afternoon or the evening. That was like awesome to me, how much they changed, especially because the sample was much more concentrated and this one was much more diluted. So between 9 and 10, I had a good shift. And then like, it just keeps getting progressively darker, and then like here at 11 days past in the morning, got a great like jump. But then since then, it's kind of like leveled off. The sample was diluted, so I think it probably would have been darker. And then this was the day after surgery, so that was 12 days past. Actually, I think this was the day of surgery. I think I did one right when I got home. And then yeah, there's a day past surgery, and and then a day and a half passed, and then today, and then I took both of these today as well. They all look the same, I think. I don't know, maybe the bottom one looks darker. I don't know, I hope, but I don't want to get my hopes up, because if it is ectopic and I have to get a shot that's gonna abort it, then that would break my heart. But anyway, then on this other side, at 8 days past, like, you can barely even see it. There's like a shadow on the 25 MIU. And then by 9 days past, it got significantly darker. 10 days past, just a little bit. And then again, you see like between 10 and 11, it was definitely positive. And then it kind of on 11 from AM to PM just leveled out. It went up a little bit, which I thought was actually kind of awesome, because like that was less than 24 hours and it got darker. And I know that like the HCG tests aren't quantitative and that they're qualitative, but like seeing these line progressions makes me think that like it is a pretty accurate depiction of HCG levels going up. So at this point, who knows if it's a healthy baby or not. I don't know. Wish me luck, give me prayers, all the good vibes. Either way, hopefully my story didn't scare you. Ectopic pregnancies, even if I do have one, are really, really rare. I don't think I had any risk factors other than maybe my miscarriages, which I don't actually know the cause of yet, because I was supposed to see a fertility specialist in October, but I don't know what's going to happen with that or what happens with the pregnancy. But hopefully at least the line progression was helpful, and whenever I know more about what is happening with my pregnancy, I'll let you guys know. Or you ladies, you loves, I don't know, whatever I want to call you, I'll let y'all know, and hopefully that'll put some more context to my progression and help people be informed and like maybe not fall into what I fell into, because I promise you guys, if I had known, I would have said like, please let's just wait and see. I wouldn't have had the surgery. I would have stuck to my gut and my intuition and my inherent knowledge of myself and my body and when I inseminated, and I wouldn't have second guessed myself because a doctor told me to. So I just can't say it enough. I really hope that me sharing my story helps someone. All right, peace, love, light. Love you guys.